like I had preeclampsia during my pregnancy, and I had went to the ER locally. And as soon as I told them I was on methadone, instantly everything changed. Their whole demeanor changes towards me.
Jenna Lewis said she felt rejected by the medical team she counted on to help her. It's a painful bias experienced by many battling opioid use disorder. They avoid seeking medical attention to avoid judgment.
You know, most nurses, and people don't understand. They think, well, why doesn't she just stop using? And most women that I know in their addiction stay out there and they don't get OB care. And their babies are born addicted to street drugs. I wanted to change my life. I just didn't know how.
Until last year, when she gave birth at Marshall Medical Center in Placerville, California, a hospital treating patients for opioid addiction by offering several FDA-approved drugs, scientifically proven to eliminate the symptoms of opioid withdrawal and cravings. It's called MAT, or Medication for Addiction Treatment, and it works.
Of course, this is what we should do. This is what we do with every other chronic disease we treat in our emergency department. We use evidence-based medicine and we treat them with everything we can and give them really good referral.
A referral to outpatient treatment services at the Marshall Cares Clinic, conveniently located down the street. The staff here provide MAT medication and so much more.
We've sort of been doing our rounds to educate and share our perspective and share what is standard of care treatment for these patients with the different parts of the hospital, and more closely working in collaboration with the different provider teams as patients move through their hospital for different care.
Many providers now administer medication for addiction treatment, and they have another resource. They can contact Eric Hill, who fills a unique role. He's a substance use navigator and acts as a link between the Marshall Cares Clinic, the medical staff, and patients.
I come into the hospital and I have a list of referrals from doctors, nurses, case managers, and other hospital staff, whether it's from the emergency department or the inpatient side, ICU, birth center. And the fact that they're grasping onto this idea of actually helping these people instead of discarding these people is huge.
It was a labor and delivery nurse who contacted Eric about Jenna Lewis, who, she suspected, struggled with opioid addiction. Eric met with Jenna, who confirmed her struggle, and then Eric called Dr. Lonnie J.
She came in and she told me, Jennifer, what you have is a disease. And me and my husband just looked at her and she said, do you want to get that under control?
There was an opportunity for a new path for her, but she needed medical intervention while she was there in the hospital to be able to get there.
I was scared to death, but I seen the trust and the faith she had in me. She built me up. She absolutely built me up. She went away for about, I don't know, an hour, and she came back with this handwritten plan. When I left the hospital, we had my prescription in our hand before we left Placer County.
It's a transformative moment, right? It's a moment in your life where you come to somebody and you say, I've got your back. You know, I've got great medicine that's going to help you. I have a plan for you. I have somewhere for you to go, a set appointment time for you tomorrow. That feels good.
So much of medicine, we don't really get wins out of it. You know, we stabilize blood pressure, we stabilize diabetes, but seeing someone who's struggling so significantly and they don't know their way out, and we stabilize them on medication and they come in to see me the next day and say, I feel normal again. That's such a huge win.
The fact that they treated me like a human being, an adult, and actually were caring and put aside their own opinions and just focused on the medical situation there and got to know me as a person, it made all the difference in the world because I'm clean today.